Did you know that a large number of cardiovascular diseases are related to how blood flows through your heart? Be it heart failure, congenital heart diseases, or valvular heart diseases, the heart and the lungs, the circulation through these is at the center of these diseases. Hi, I'm Dr. Mateen, a medical doctor and physiologist, and welcome to my YouTube channel where we discuss the physiological basis of health and disease. And in this short video, I'm gonna share with you 5 key facts of circulation through the heart and help you apply them using clinical scenarios. Let's begin. If you have ever noticed the human heart and the lungs, they are positioned just like this, one in front of the other. But in reality, if you want to understand the physiological basis, you need to see that these are two different organs which are in series. What do I mean by that? The first is the pulmonary circulation, which is going through your lungs. The second is the systemic circulation. These two organs are connected in series, and that brings me to the first key factor. The heart and the lungs are connected in series. Let's see how it happens. Your heart receives the blood through the superior and the inferior vena cava and some veins which enter into your heart. That is the deoxygenated blood. This deoxygenated blood now moves to the lungs to become oxygenated, after which it comes out to the pulmonary circulation, enters to the left side of the heart, and then it's pumped out to the systemic circulation. This arrangement from the heart to the lungs and back to the heart is in series. Compare that to other organs of the body, for example, the liver, the brain, the kidneys, the intestines, and the muscles. You find that the blood flowing out of the systemic circulation from the heart to these organs goes parallelly. At the same time, all these organs receives blood. And this is very much in arrangement. For example, if you see a highway where there are a lot of traffic going on, and then there are sideways roads which lead, the traffic on the highway is in series going one after the other. But the ones which leads to the side roads is actually in parallel, that these multiple cars going on the multiple roads go in their direction without following each other. Now, this is very essential. What is the advantage of this parallel arrangement? This parallel arrangement ensures that there is a decrease in the total vascular resistance. So this is a big difference between the circulation, which is connected in series through the heart and the lungs, and the circulation to the rest of the body, which is called parallel arrangement. Let's move on to the second big factor. Now let's try and understand the second key aspect, that the blood flows from the right heart to the lungs and then from the lungs back to the left heart. Let's take a scenario. An infant less than 1 year of age presents to you with breathlessness and looking blue, which is called as cyanosis. What's happening in this child? One of the common things which can happen is there is a defective blood flow across the heart. If you look at the blood flow across the heart, we find that the venous blood from the right atrium enters into the right ventricle through the right atrioventricular or tricuspid valve. Then the right ventricular blood leaves through the pulmonary valve, reaching the pulmonary artery and going towards the lungs. This is the deoxygenated blood. Blood gets oxygenated in the lungs, and the pulmonary veins from the left atrium brings this blood to the left ventricle across the mitral atrioventricular valve. Then the left ventricle pumps this blood across the aortic valve to the systemic circulation via the aorta. Let's get back to the young infant who came to us looking bluish in color. What's happening in this infant is a condition called patent ductus arteriosus. During intrauterine life, that is before birth, there is a connection between the two major vessels, pulmonary artery and aorta. At birth, this, or within a few days, this closes off. But unfortunately, in some patients, this does not close off. So there is an admixture of blood, venous blood with the arterial blood, resulting in reduced amount of oxygenated or increased amount of deoxygenated blood, which produces the bluish discoloration of the skin and the mucous membrane, especially around the lips, around the fingers and the toes, which is called cyanosis. To understand this again, remember, the key lesson here is the blood flows from the right heart to the lungs and then from the lungs back to the left heart. If there is any admixture of blood, then it is called shunting, which is an example. The fourth key concept in the circulation through the heart is that the heart has two pumps, atria and ventricles. If you look closely how the blood moves from the atria to the ventricles, you find that it happens at the same time. This is as if the two atria on the right and the left are beating together, sending blood to the ventricles at the same time. And the same thing happens in the ventricles when the right and the left ventricle pumps blood at the same time across the pulmonary artery and the aorta respectively. That means we have got two atria, the right and the left atrium, and two ventricles, right and the left ventricle, each acting as a single unit. That is, the two atria beat together as one unit and the two ventricles beat together as one unit. So we say that they have two pumps and two circulations in the heart. The applied aspect of this is, since they beat together, the rhythm disorders of the heart called as arrhythmias occur together in them. This will be dealt in details in the later videos. Now let's move on to the fourth key concept here, that circulation through the heart is guarded by unidirectional valves. This is how blood flow through a normal heart looks like. There are valves both on the right and the left side of the heart called atrioventricular valves, which allow the blood to move from the right side of the heart, that is the atria, to the ventricle, and the left side of the heart, atria, to the ventricle. And the blood is now being pumped out from the ventricles through two valves called as pulmonary and aortic valve. But if this does not happen, in one condition called stenosis, where there is narrowing, and in another condition called incompetence, where there is regurgitation, we call them valvular heart diseases. Now let's have a look at the circulation through these valves. The first valve is the right atrioventricular valve and the second is the left atrioventricular valve. These valves are also called as the tricuspid valve and the bicuspid or the mitral valve. These guard the right and the left atrioventricular openings respectively, allowing the blood only to move in one direction. They do not allow the blood to move in the opposite direction, and that is where the functionality of the valves comes into the picture. There are two more valves which are attached to the ventricles with the aorta and the pulmonary artery junction. These are called as the semilunar valves, the pulmonary valve and the aortic valve. These also have three cusps. Again, they do not allow any blood flow to come back once they have transferred from the pulmonary artery and the aortic valve to come back into the ventricles. If you have a look at the picture here, attached to the ventricular surface, these are cord-like structures which are called as chordae tendineae. These are connected to the ventricular muscle belly, that is the wall of the ventricles, by muscles which are called as papillary muscles. And what happens is, in conditions, there is what is called, they prevent the eversion of valve leaflets, and that is why they are very important to prevent regurgitation of blood flow. Applied aspects, we have got condition called as aortic stenosis, where there is a narrow valve. Same thing happens with mitral stenosis. In these conditions, the valve is so narrow that the amount of blood which flows across the valve is very much narrowed, and this may not be completely blocked, but there is narrowing. On the second hand, we have regurgitation, also called as incompetent valve, which can happen with aortic or mitral valve especially. In these conditions, the blood is allowed to come back to the ventricle, especially in the left ventricle from the aortic valve, and this increases the left ventricular load. So these are the applied aspects related to this concept. To come back to the concept, circulation through the heart is guarded by unidirectional valves, otherwise which results in stenosis or incompetence. The fifth key concept here is the difference between pulmonary and systemic circulation. If you see the heart pumping into the lungs, it's much more easier, and the blood which comes back to the heart also flows easily to the heart. But pumping into the systemic circulation is much more difficult. That is why we say the pulmonary circulation is a low pressure, low resistance system, whereas the systemic circulation is a high pressure, high resistance system. I will cover the special features of pulmonary circulation in another video, but the applied aspect here lies in the fact that the size of the right and the left ventricle differs. The reason for that is the right ventricle has very little resistance to overcome. The growth depends upon the resistance, whereas the left ventricle is much more bigger and thicker. That is, left ventricle is bigger in size, mainly because it has to pump across the high pressure, high resistance systemic circulation. This becomes important because left ventricle hypertrophy is much more common, and right ventricular hypertrophy is similar to left ventricular but less common. More commonly, we involve abnormalities like left heart failure or left ventricular hypertrophy. There we have the 5 key facts of circulation through the heart. Fact number 1, the systemic and pulmonary circulations are connected in series. We talked about the resistances in parallel and how it's easier or the resistance is less within the various organs as the blood flows from the heart to the organs. The second key factor here is blood flows from the right side of the heart, the lungs, and then from lungs to the left heart. We talked about the importance of shunts and cyanosis. Third, we talk about two heart pumps, atria and the ventricles. The applied aspect was they beat together as one unit, atria beating at once and ventricles beating at once. Importance lies in the arrhythmias or generation of abnormal rhythms. Fourth key concept is circulation through the heart is unidirectional. That is, blood only flows from one chamber to the next chamber without going back. Importance lies in stenosis and regurgitation or incompetence as valvular heart diseases. Lastly, we talked about that is the pulmonary system is a low pressure, low resistance system, whereas the systemic circulation is a high pressure, high resistance system, because of which chamber size enlargement is different from the left ventricle and the right ventricle. Here is the end of the video question for you. Can you explain the 5 key concepts related to circulation through the heart? It's very important for you to review at this point. Pause the video and try to recall what we have just learned. Even you can make a small concept map and write down in your book or on your iPad. Unless you review your questions or discuss with your friends, the memory formation in the brain does not result in long-term memory. That's all from me. I'm Dr. Mateen from Dr. Mateen Physiology, where we talk about how health happens, how disease happens to help you understand and become a better healthcare professional. If you like this video, please do subscribe, click on the like button and click the bell icon to be updated about my latest videos. All the best.